Facial nerve. It is the seventh cranial nerve. It is a mixed nerve, contain both motor and the sensory component. It is the most frequently paralyzed nerve among the all peripheral nerves of the body. Functional component and nuclei. To remember this, you can use a mnemonic. What is that? It is face, ear, taste, tear. Now, how to use this mnemonic? First is the face. Now, face actually indicates not only that muscles of the facial expression, but all the muscles which are developed from the second branchial arch. So, it is a special visceral efferent type of nuclei. That nuclei is present. This is the transverse section of the pons. It is anterior side, it is posterior side. Here lies that fourth ventricle, and this is the floor of the fourth ventricle. Now, here lies that motor nuclei of the facial nerve. And this here lies, that means in that nuclei lies the cell body of that fiber. And the neurons are going to supply that all the structures which are derived from the second branchial arch. Now this fiber, it goes like this. Here it is the abducent nuclei. It goes first this way, medially, then it encircles here. Actually, in this zone, this is known as the facial colliculi. Then it encircles, and then it goes like this. So, here it is going to supply all the muscles derived from the second branchial arch. So, it is a special visceral efferent type of fiber. And this area is known as the internal genu of the facial nerve. If we draw another picture, that is the pons and it is medulla. Here lies the sixth nucleus, and here lies, say, the just below this is the seventh. So it is not only going from that medial to lateral, but it also ascends above, encircles it, and this is coming out at the junction of pons and medulla. There are two roots. This is one root, that is the motor. Another is the sensory, where all other fibers are present. Now that is that face. Second is the ear. Actually, the facial nerve carries the cutaneous sensation from the concha of the auricle. Let me draw a diagrammatic structure of the face. Say, here I am drawing that structure of face. So, muscles of facial expression already supplied by this. Then auricle, here lies the concha. The cutaneous sensation from this zone is carried first by a branch of the vagus, then it is through the seventh, and the cell body of that cutaneous nerve is present outside that central nervous system. So it is cell body, say, present in this zone, that is the geniculate ganglia basically. So one is that peripheral process, and Suppose this is the peripheral process and another is the central process. So that central process enters like this. So this is afferent, and that afferent is the general somatic afferent. And that nucleus is the trigeminal nucleus, the spinal nucleus of the trigeminal nerve. And this is the motor nucleus. So this is the ear. Let me draw another one here. Next is the taste. Now, facial nerve carries the taste sensation from the anterior two-third of the tongue and soft palate, and that is a special visceral afferent fiber. So again, it is carries that sensation. Again, the cell body is situated here. So peripheral process carries the sense, and the central process is enter inside, and here lies that nucleus. So this is a second order neuron, and that nucleus testing the taste. Now we can remember like this: taste salty, so nucleus tractus solitarius, and that is a which type of fiber? Yes, it is a special visceral afferent. So that is taste. Another thing is tear. Even that lacrimation is not so easy. You will find that. So tear, it is the function of a general visceral efferent. And for that lacrimation, there lies one nucleus. Regarding this nucleus, you'll find that in different book, in some book, it has been written that superior salivary nucleus only. In some book, you'll find lacrimatory nucleus and superior salivary nucleus. Basically, what is the thing is that if we consider there are two nucleus, both are in the same column and both are general visceral efferent. But what is that? In this zone, the cell bodies are so intimately arranged, which are going to supply to different things, so intimately arranged that you can consider them a single nucleus or you can consider a bit different. But as the function of both these two are same, that's why, and as they are so intimately related, so that's why sometimes it may consider as a single one. Now, what is the function of this nucleus? This nucleus not only going to supply the tear, you can remember when it is tearing, also some secretion from the nose, and there are also two small salivary gland, submandibular, sublingual, their secretion, and the secretion from the gland of the soft palate, and I've shown that nasal cavity. So many secretions. So not only tear, but all the secretions, that means they are general visceral efferent. These are supplied by this nucleus. So it is going like this. This thing constitutes the sensory root. This is the motor root. In reality, this root is the thicker than this. See, in the sensory root, there is one axon which is motor. It is a secretomotor. So this is that sensory, it is a misnomer basically. This is special visceral efferent secretomotor fiber going to supply that area. So see, again I am going to repeat that functional component and the nuclei. How will you remember? Face, ear, taste, tear. Face, this is that motor nucleus which is going to supply all the muscles of facial expression and all other muscles which are developed from the second branchial arch, and that is a special visceral efferent. Second, ear. Ear. From the concha, the cutaneous sensation is carried first by the vagus, then it is handed over to the facial, then the cell body is present in that geniculate ganglia. Sorry. Then it is carried centrally up to the spinal nucleus of the trigeminal nerve. So that is a general somatic efferent. Then taste, that taste is carried up to the nucleus tractus solitarius. Again the cell bodies are situated here in the geniculate ganglia. And tear, secretomotor fiber from that superior salivary nucleus, and you can also mention that lacrimatory nucleus. So from this nucleus the fibers are going to supply the secretory glands for the lacrimal gland, submandibular or salivary gland, or glands of the nasal cavity and soft palate. Now, how these nerves are coming out? Actually, if we draw the this diagrammatic draw, suppose I am drawing the medulla, pyramid, olive, inferior cerebral peduncle. On this side also pyramid, olive, and then inferior cerebral peduncle. So this is pyramid, olive, and it is inferior cerebral peduncle. And this is the pons, and here is the midbrain. Now, actually that seventh nerve is coming out in this zone. In between that olive and inferior cerebral peduncle, we'll find one thicker motor root and one thinner sensory root. This sensory root is also known as nervus intermedius. If you want to know the all other nerve in relation to that, I can give you a short discussion on that. It is the third nerve coming out anteriorly. Fourth is actually coming from the back. Fifth is present on, say, there. Here is the motor is the smaller one. Another root is the sensory coming out, a thicker sensory. Then here lies the sixth. Just describe the seventh. Then here lies the eighth, 9th, 10th, 11th. In between the olive and inferior cerebral peduncle, 9th, 10th, 11th. Rootlets of the 12 is coming out in between the pyramid and olive. So that is the 12. So this is 3rd, 4th, 5th, 6th. Just this is the 7th, 8th, 9th, 10th, 11th. In between that olive and inferior cerebral peduncle, and 12 in between the pyramid and the olive. And it is that lateral view, anterior view, and is the cross section. And this is the intraneural course of the facial nerve. And this is the facial colliculus. It is the 4th ventricle. Sorry student, I have wrongly mentioned is the special. It is basically a general visceral efferent fiber. So there are two efferent. One is that special visceral efferent, another is general visceral efferent, and two afferent, special visceral afferent and general somatic afferent fiber in this nerve.